Are you suffering from dizziness and vertigo that you can't quite figure out what's causing it? Have you spoken with multiple doctors and they found nothing? Dizziness and vertigo has multiple contributing factors or causal factors that could be driving it, and many of them are unrelated, and it could be coming from multiple areas. So today's nugget is going to dive into that. I'm Dr. John Bartemus, and I'm putting the pieces together to help you live a life at optimal. What can cause dizziness and or vertigo? There are many answers to that question. One is aging. There is a scientifically documented physiologic decline of the vestibular system, so that in some people, just aging leads to decline of their vestibular system and can result in dizziness and or vertigo. Your vertigo or dizziness could be benign paroxysmal positional vertigo, where a little crystal breaks loose in your semicircular canals of your inner ear, and when you move, it moves in the canals, stimulating the hair cells aberrantly, which can create dizziness or vertigo when you move your head a certain direction. If BPPV is the cause of your dizziness or vertigo, a manual therapist such as a chiropractor or physical therapist or neurologist should be able to take you through positioning maneuvers to reduce the BPPV and take care of the vertigo. Vertigo can be driven by cerebellar deficits. So just like aging and decline of the vestibular system can lead to it, if you have cerebellar dysfunction, which is the area of the brain that controls movement, coordination, and balance, then that could be driving the dizziness and or vertigo symptoms. The brain requires glucose and oxygen to function. So if you have any blood sugar dysfunction or oxygenation issues or iron deficiencies, any of those could lead to suboptimal brain function. And if your weak link of your chain in the brain happens to be the vestibular system, that may manifest as dizziness or vertigo for you. Another driver of dizziness or vertigo could be travel, and could be pressure changes associated with flight and or the ups and downs of being on a cruise ship or a boat. So if you've had recent travel, pressure changes during flying could result in what's called superior canal dehiscence, where the top of the posterior semicircular canal of your vestibular system blows off, and now there's a difference in flow of the fluids that make up the semicircular canals, and this can result in dizziness and vertigo. Being on a boat could also lead to maldebarkment and lead to vertigo. Also, if you've had a recent infection, a viral infection could cause vestibular neuronitis, which can cause dizziness or vertigo. A bacterial infection could cause labyrinthitis, which may result in dizziness or vertigo. You're more likely to have it with the vestibular neuronitis. And then lastly, autoimmunity can drive dizziness or vertigo. You could have Meniere's disease, which is more and more recognized as an autoimmune disease, which also creates tinnitus or ringing in the ears. Or you could have autoimmune attack on other tissues of the nervous system, like the Purkinje cells in your cerebellum, like the myelin basic protein, which contributes to MS. Basically, there are multiple neurologic antibodies that have the potential to create dizziness or vertigo. So if you are dealing with dizziness or vertigo and you don't know what's driving it, these are multiple areas to have assessed and have diagnostic testing done to prove or disprove these. And when you find the right one and address it, your dizziness or vertigo should be corrected.